Hello, welcome to Yo's Dental Studio, and today we'll be reacting to some videos. My name's Surprise.
My name's Craig.
Let's get to it.
Hills Reacts.
My dentist was like, no, Paul, it's not standard procedure to get general anesthesia for a teeth cleaning. But I love going to the dentist. You get to tell them that you floss every day, and then they floss you, and your gums bleed. And then they know you're a liar. And you get to have a suction tube that sucks the inside of your cheek and makes a noise like... And they go, raise your hand if it hurts. And you go like that. And then they stop. And then they just keep going. And you get to lie in a chair and stare directly into the strongest lamp on planet Earth. And they wait until you have 7 instruments in your mouth before they ask you a question. And you're just like... And their cleaning pick device strikes every nerve on your teeth and at the same time sprays water all over your face. And the whole experience is just cleansing and uncomfortable. So I love going to the dentist. So, okay, thanks, bye. My dentist was like, no, Paul, it's not standard
I think that's a pretty accurate description of everything that happens here, you know?
Pretty accurate.
Yeah, pretty accurate. It's also giving you some semblance of power, like say you win, and then we'll stop. Only for a second. Then getting back right into it.
And then you ask them, what's the problem? Oh no, it's just discomfort.
Oh, that's perfectly natural. Oh, that's what we do. You know, I was thinking about it the other time when we were working. I'm like, we're like human mechanics. Like, you're here for your service. Oh, okay. Oh, there's a little bit of a hole in there. Catch it up. You're good to go. So it's like, oh, human maintenance. It's a part of it.
Yeah.
Can be annoying, but if you don't do it, it gets far worse.
But you know what? In the defense of dentistry, it's better. Like 100 years ago, dentistry sucked. It really sucked. There wasn't, like a cleaning, right? You do a cleaning now, you know, we use that machine that vibrates your bones. But then they used to had to use hand, and you be on the chair for such a long time. Whereas that spread it off mechanically. So this is the type of stuff. Yes, it sucks.
It sounds like our parents. Like, we had it far worse back in the day.
Yep.
We used to walk 10 kilometers to school. Like, you have very good.
Yeah, you have to very good. And what was before dentistry? The barber. The barber. Yeah, the barber will pull out your tooth. So, I mean, it's not that bad now. I mean,
They're good.
you got it good.
Be alive.
You know, and it'll get better. One day, who knows? Maybe we'll just shake off all the dirt and maybe we'll re-routine. I don't know. But this is the best we have
This is what you got now.
in 2026. So, I'm sorry.
Daun Jaic Avenue.
Thiếu một giấc review dia premium review cái thiếu
Oh, that is pretty awesome. Well, what do you mean gloves? I'm gonna stick my bare finger in your arm.
That is hardcore.
Yeah, that is hardcore. Oh, I don't know if I would do it. I mean, I'll do it for a loved one, sticking my finger. I mean, that came out right.
Oh,
Like,
speaking your finger that love one. No comment. Cut.
cut the camera. That is ballsy.
Yeah, but you know what? Before the AIDS pandemic, you know, they didn't wear gloves. Dentists didn't wear gloves. So if you have 1960 textbooks, you see them raw doggy, you know, raw doggy. No, but they had no protection, guys. They were raw dog, you know.
Yeah. See, you've got it good. You've got it good. Now at least we cover up a little bit.
You know, like,
So it's
yeah. But shout out to this kid.
shut out.
Oh man.
Yeah, they look thugged out.
Even he looks like a it's crazy.
Yeah, but he's probably not. He's probably like a very good guy.
You know, like he looks like he's cool.
Yeah, that's what we used to say. Yeah.
It's attacked all inside of my nose and it's ate away everything inside my nose to the state where I've got no septum left in my nose at all. They decided that I'd need 7 implants in the top and 6 in the bottom. When he was doing this sinus lift or the bone graft, he was getting some kind of hammer and it was smashing up into my face, and you got like some temporary denture put over the top and you were sent on your way. After a week of being back in the UK, I knew something wasn't right. My face was swelling up a lot. My nose was streaming all the time. It was definitely my sinuses. I'd go to our local doctors and the local hospital. They kept checking me. No, you're fine. No, you're fine. Nothing wrong. I've gone wrong and now I'm suffering for it. Now I'm dying slowly. I know I am. I eventually got admitted to hospital when I called 999 because I thought I'd had sepsis and I was going to die. What a lot of people don't know is whenever you go abroad, you cannot get help in the UK. They will not touch you. Say goodbye to any NHS, say goodbye to your dentist, anyone.
This is unfortunate. Let me tell you exactly what happened. You cannot place 13 implants and a final denture in 4 days. Bone needs about 3 to 6 months to osseointegrate around each implant. That means making the bone and the implant becoming one. That is biology. The reason Turkey clinics do it in 4 days is volume, not math. They place the implant, screw the bridge in, and put you on a plane home. Whatever heals, heals. Whatever does not, your problem. So one of her implants pierced into the sinus. That is how she ended up losing her septum. That is not bad luck. That is a placement angle that should never have left the planning state. The NHS stent is not cruelty, it's structural. The British dentist who has to fix it inherits all the liability. They do not have the original records. They don't know the brand of implant that were placed. They don't know the size. They don't know the width, nothing. And most Turkish implant brands are not even sold in the UK or the US. So you'll probably have no matching parts. So cleaning up somebody's big mess up costs 3 to 5 times what the original quote was. Nobody wants their name on it when it goes wrong. If your local dentist quote feels too high, get second opinions. Ask for itemized treatment plans. Ask for clinical photos. Do not fly to a country where your dentist cannot be held liable if the things go south.
It's attacked all inside of my nose.
Yeah, that's wild.
Ooh, that's why the back was wow. That was so wow.
Super.
That's
We made a video on this a while back about like going to Turkey. That like it's great because it can be affordable, but no one can be held liable. Maintenance is just, and most dentists won't be able to touch you because again, like the other guy said, we gonna react to the reaction video too. But he basically did our job for us.
He did our job for us. Thank you, Tom. Because I was the nice to say, like, yeah, you see how that, okay, your sinuses are right here. So like
Wonderful chip out.
right here. So when certain teeth are very close to the sinuses, even like if you do an extraction, right, sometimes you can go through the sinus. So if you don't measure your implants correctly, you can go into the sinus. You can perforate the sinus, right? So that's what happened here. And that got infected. And when that got infected, your sinus and your nose are connected. That's how you get that. But wow.
Oh, so bad for her.
That's sad, man. Like,
Yeah, super sad.
but that's gonna be fixing the nose, fixing the teeth, fixing the ridge. Oh man.
Yeah,
Oh, sad.
tragic.
Sad.
Well, yeah, so like you said, keep it local. Wherever you are, just keep it local. If it's too expensive, I guess budget for it or get a cheaper treatment plan. It's not worth the hassle or the types of consequences you could face. You could lose a nose.
Here's a thought experiment. What about the guys with lots of way too much who want to go overseas for the best treatment? I know. Just like
I mean, I don't know. I'll speak for South Africa. We have some really, really good plastic surgeons, some really, really good maxillofacial surgeons, periodontists, and everything. We've got the best. Yeah.
okay, but let's say you wanted Dr. Duval Anush to do your work, yes, ma. Because I like his work. I think he's the best. I've not seen anybody who's like him in the world, and I've got lots of money. I mean, I've got 6 Rolls Royces parked.
Yeah, you can always go back to for you. Yeah. If you know you can't afford at least 6 trips back, 3, maybe just keep it here. But if you can, and like going to another country is like catching a taxi from Soweto to CBD, more power to you, my boo. More power too.
I'm sorry, Lee. I'm sorry. Which was that celebrating?
And to me, really,
Yeah, I was like, was I removing a tooth or doing a filling? Can't remember, but I was doing like an inferior alveolar block, like on the lower. And for some reason, the eye couldn't open anymore. Or close. The eye couldn't close. So we just shut it, put a eye patch on that girl. Little pirate. It's pretty, yeah, it's pretty temporal. And she was fine afterwards. Yeah. So that happens. Nerves.
because I thought it usually happens when you like go.
That's what I thought.
Yeah,
Sorry, that's something. It surprised me that
it's like a little opening here, right? If I know my anatomy correct,
it is the infraorbital nerve.
and this your nerve comes out of here. If you can feel it yourself, feel it yourself. Don't like just touch it. You feel like there's this group, and there's nerves that come out of there. It's so if you want to, some people like when you want to inject here, it might numb it up. So then your eye is numb now. So that's how you get that. But
Yeah.
little story is very
Well, very fascinating. Very fascinating. I've had a couple of nerve issues this year, actually. So, I had bad nerve juju.
stop getting on my nerves.
You're fine. Sit back. I think I'm gonna die in this house.
Alvin and the Chipmunks.
Yeah, that's what I thought. On the chipmunk. Yeah, so sometimes you could do that. A lot of patients do go for that, like so you don't have to, recover and heal, like get traumatized, recover and heal. So like just do it all at once. With me, when I do wisdom teeth, I prefer to do it like just on one side. I would do the right side, you heal, then you do the other side. Because although it is just all at once, can be quite difficult, like especially to chew afterwards, because which side are you gonna chew on? Both sides are pretty much swollen. But also there's a lot of cases where people removed all 4 and healed seamlessly. So the real right method is that I prefer the least traumatic experience.
Because I removed all I wasn't.
Like all at once.
Also, you look like a little chipmunk. Yeah, I did. Look like a chipmunk, took them out, But also, you have to remember, it also depends on the teeth themselves. Because my teeth were like this, but they're not like facing down straight. So, yes, it was a hard extraction, but like it was not like they had to this case is very difficult, I'm sure like a general dentist of considerable amount of years would have been able to do my wisdom teeth from what I remember. So if your wisdom teeth are also hard, it means more trauma, and that's why you might feel more pain afterwards. So it's not a one size fits all, And also the nice thing about taking them out one go, some people do it under general anesthesia, right? And if you do it under general anesthesia, you don't want to go under general anesthesia twice.
Yes.
General anesthesia is what?
Yeah, it can be also taxing on the body.
Yeah, like I was reading, this is true stuff, 2 days ago. Like, what do people feel like when they go under GA? They feel like, for my explanations, like they wake up and it's like they sleep and like, oh yeah,
I've been on the GA.
is that the GA?
Oh yeah.
Oh my god.
Yeah, I had an ascended testicle, so they put me under because like mine was like inside my body. Then they gotta be outside so they can have like normal temperature so I can reproduce. Only for me to get a vasectomy afterwards. I should have just kept that baby in there. But I'm not a woman. But I don't think it's worse than giving birth 3 times, because that's what the caption said.
Yeah, yeah.
Giving birth. No, I don't know. 3 times at that. I don't think a wisdom extraction can be that bad.
Honestly, I've never given birth. Wouldn't sure you happen. But if I do give birth, I'll give you feedback. Sure. Don't stop.
You're right.
This is one of the worst dental horror stories I've seen. This guy was in Turkey, needed some teeth replaced, and ended up with an implant right up against the brain. How did this happen? Well, it's actually pretty difficult. He came in for this implant. There wasn't enough bone, so he was going to have a sinus lift procedure. That's where this empty space in the cheek is used for the implant. And it's supposed to look like this, where a little bit of bone graft is added and the implant is nice and stable. But it's likely that too much force was used, and this extremely rare complication happened where the implant went all the way through the sinus and ended up right next to the brain. He needed to have emergency surgery to remove this. They managed to get it out, and luckily he's making a steady recovery.
I don't know what they meant by brain cavity. How the hell did it get to the brain?
But look, in defense of Turkey dentists, this is not a Turkey thing. This is an implantology thing. Implants are hard. Like, honestly.
The brain cavity?
No. Like, I'm not saying that blunders would be seen with implants,
Oh, maybe okay.
Yeah, I'm just saying, like, implants are hard and implants have weird complications. And that's why people don't want to do implants, because they're like, yo, I'm going to screw what and end up where. People are scared of implants. Lots of people, because there's so many vital structures up here. There's your eye, your sinuses, so many nerves.
I'm trying to figure out the brain part. Like, these structures you have to pass through that? The brain is far.
I mean, for what he said, it's like
It went past through the orbits.
Yeah.
That's one non-implant. That is freaky. That is a lot.
I will not speak because
No, I'm not critiquing the implantologist. Just Lord,
that's why implants are scary because of stuff like this. Because people see this and like, you know what? Let me step back. But
me, an idiot, jumping straight into implants. So
yes,
I'll try not to get any into your brains. I'll try. No promises.
The worst dentist I ever had was in New York City. The guy came around the corner way too spray tanned in like scrubs and just
Did he have jewelry?
He had a necklace.
Okay,
He had a
all
necklace.
right.
He was two queens. He was like, "How you doing?" He's like, in my mouth, and he's like, "So, what are you a fan of?" I'm like, "The 49ers." And he's like, "Nah, you guys, your run game's not that good." And then he didn't. It felt like he just went like, "Boop, boop, 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 boop." Oh yeah, you're good to go. And I went, I don't know. I don't know dentistry, but that didn't feel like he
that
did
didn't
anything.
feel right. That felt like
I went to him twice, and then I was like, "I'll just wait." My Prince Charming is out there.
it's like when you go to a Jiffy Lube.
Yeah,
and
yeah.
and you leave the
Yes.
car, and they come back and they go, "Yeah, it's all done."
Yeah.
You're like I've been looking at it. I feel like you guys. He goes, we're underneath working. We're underneath. I'm
They
like,
definitely
I don't
Jiffy
know.
Lube. He did a Jiffy Lube clean where he just was like, I don't know, it's good. This guy doesn't even know what's going on there. He doesn't know what a bicuspid is.
I could do this all day. I
And
do
he
this
goes,
all day.
I don't even actually look at their teeth. I've been wanted by the Gambino family since '87. He goes,
If
"This
I'm
is-
being truth be told, it's my brother's dentist.
He goes-
I'm not even a dentist.
And I just take his smocks. I come down here. I poke around a little bit. I go back upstairs. Whatever. I got a sauce going. I got to go stir it. You're good to go. Don't eat sweets. What are you, a child? And then you leave and you go, it is good dental. The worst dentist I ever had was at York City.
But one day from like ever anyone's like worst dentist. Yeah, and he just came in there with dreadlocks and he said, "What's up?" And skinny jeans and dreadlocks. I was like, "What's up?"
but it shows that perception counts, Because somebody might be like, "Oh, that guy is so bad or worse," and he just came and looked at me for 2 minutes and said, "There are no issues."
Get out of here.
Get out of here. And somebody be like, "Oh man, he was so great. He asked me what's my favorite color."
Yeah, and he had this tan and this necklace and he had this Queen's accent. Now, what are you, fool? Stop eating sweets.
Perception.
You do it.
Oh, that's the last one.
That was the last.
Oh, that's some.
That was the last one. These were some good videos. Yeah, I enjoyed it. I liked it a lot. Though.
This is a good selection.
Good selection.
I like the
dog.
comedic relief at the end. You know, because that. Oh my gosh! After seeing brains and noses, damaged.
Yeah, that was a lot.
You know, it's nice to have something lighter on it. God bless you, Tom and Tom.
Thank you for joining us.
Thank you.
Enjoy the rest of your week.